Initially, I started having symptoms of weight loss, freaking going to the bathroom, blood, mucus, blah, 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 blah. And I was convinced I had cancer because I dropped like 25 pounds in about a month. And finally, when I went in for a colonoscopy, they told me I had UC. They put me on some pretty light medications, and then I felt better.
So David has moderate to severe ulcerative colitis. And with David, we've been through multiple therapies, over 4 different biologics or immunosuppressive therapies. And David would get better maybe for 6 months or a year, and unfortunately, in which we see, not too uncommonly, patients might feel well initially and then lose response.
And the last time I was in a flare, prednisone just wasn't working. And I started getting more concerned that I was gonna end up needing an emergency surgery. And that caused me to say, I just need to elect and get it done. And I was kind of tired of being sick.
We had this discussion over the past year, sort of these past ups and downs. At what point do we sort of pull that trigger and we're like, look, let's get you feeling well, let's get you feeling well for the long term, and you could sort of move on for your life and not worry about taking time off of work and so forth.
Dr. Peterson referred me to Dr. Ramsey. He made me feel hopeful that surgery was actually a good decision. It's scarier than the medication, to me at least, because it's irreversible. The medication you can try, and if it doesn't work, and you stop taking it, and for the most part, the odds of you having an adverse reaction are relatively low, right? With the surgery, you do it once and then you're done. You can't say that they should put your colon back in. So I was really hesitant about it, but Dr. Ramsey made me feel like it was actually going to be a good thing long term.
When I get involved as a surgeon, my job is to be able to give them a chance to avoiding a permanent outside bag, or a stoma, what we call. In those circumstances, I do a J-pouch procedure, or what we call as a restorative proctocolectomy, which means creating a new reservoir to replace the rectum so our patients can avoid a permanent bag or stoma.
So today I'm having my ostomy reversed and hooked up to my J-pouch. This will be my 3rd surgery relating to this. I've not been nearly as limited now as I was the past decade. We're getting a dog, so I'm excited about that. And that's something that we wouldn't have done prior, right? Like, it's just, you sort of move on and you can do a bunch of things that you couldn't do before because you're just not sick all the time. I can't say enough good things about the result. It's like night and day. Things are totally different. I'm not running to the bathroom every 20 minutes. You can go through it and you can be somewhat back to a normal life without having to manage this overhead on a daily basis. My life is a lot more predictable in a lot of ways. I got a dog, as I said before, which has been awesome. And I'm just able to do things that I wouldn't otherwise have been able to do. While it's scary to go through and it's a lot to go through, it's totally worth it, 100%.